Good morning. Thank you all for joining us. My name is Jasmine Garcia Delgadillo, Health and Equity Program Manager at the California Strategic Growth Council. We would like to welcome you all to this webinar on findings and recommendations for the California Health and All Policies Task Force based on a survey and listening sessions conducted in 2021 by the UC Berkeley Othering and Belonging Institute. I would like to take a moment to introduce the rest of our Health and Equity Program team at the Strategic Growth Council. Alexandra Gallo, our Health and Equity Program Analyst, and Michael Jimenez, our Health and Equity Program Associate. The Health and Equity Program within the California Strategic Growth Council is dedicated to advancing public health and racial equity across state government, including via technical assistance, capacity building, and convening the agency-wide California Health and All Policies Task Force, among other initiatives. I also want to thank the Othering and Belonging Institute for the partnership in this effort. We look forward to our continued shared learnings. Before we jump in, we want to acknowledge our presence in the land of the Nisenan and Miwok people and recognize the important contributions of these communities and all Indigenous peoples. As we seek to advance health and equity, it is also critical to reflect and recognize the critical need of elevating and working towards advancing the health and well-being of Indigenous communities. And now I'll hand it off to Michael Jimenez, who will discuss our agenda and provide broader context for our webinar today.
Thanks so much, Jasmine, and welcome virtually. To start, I'd like to provide a brief background on the California Health and All Policies Task Force and our partnership with the Othering and Belonging Institute. Othering and Belonging is based at the University of California, Berkeley, and leads research and capacity building efforts to identify and eliminate the barriers to an inclusive, just, and sustainable society to create transformative change. And you'll hear more from them later on in this presentation. Our partners at Othering and Belonging have provided essential capacity this year to facilitate and synthesize our stakeholder engagement efforts around the Health and All Policies Task Force toward the strategic engagement of the task force. So great, we're on the right slide now. The Health and All Policies Task Force, or Task Force, as you will hear referred to in this presentation, was created in 2010 by Governor's Executive Order with accountability to the California Strategic Growth Council. SGC is named in the executive order and provides a venue to engage California state agencies and departments on the topic of public health, equity, and sustainability. The task force is staffed and facilitated by a partnership between SGC, the California Department of Public Health, and the Public Health Institute, a nonprofit organization. And we see three primary purposes and functions of the task force. One, to promote a government culture that prioritizes the health and equity of all Californians across policy areas. Two, to infuse state agency and department practices with health and equity considerations. And three, to provide a forum for departments and agencies to identify shared goals and opportunities to enhance performance on health and equity through collaboration. And in this effort, the task force also intends to uplift the missions and visions of participating state agencies and departments through a health and equity lens. So if you could transfer to the next slide, please. As previously mentioned, this presentation will provide a review of the results from a multi-phase stakeholder engagement initiative carried out in 2020 and 2021 to inform policy areas of the task force. The timeline shown here demonstrates the process carried out by task force staff in partnership with Othering and Belonging. And through this process, we were able to receive input from state and local stakeholders on facilitating the task force and incorporating a health and all policies approach within California state government. So in April 2020, the SGC Health and Equity Program was established to provide dedicated staffing at SGC for the task force. And throughout fall 2020, the program staff coordinated internal key informant interviews with state government employees to learn about the barriers and challenges to achieving health and racial equity in state government work. And during these conversations, we were encouraged to learn more about the health and equity priorities of stakeholders across California. So we administered an online survey from January to March 2021. In May and June 2021, Othering and Belonging facilitated 4 listening sessions to continue these conversations with stakeholders. So again, you will hear more from Othering and Belonging about the results of the survey and listening sessions later on in this presentation. This recorded presentation is intended for audiences that participated in the different elements of this process. So stakeholders include state and local government employees, and representatives of statewide, local, and community-based organizations across California. We are so grateful for your contributions and thank you. Now, I'd like to introduce Alexandra Gallo, who will provide additional context on how your input will inform the future work of the HIAP Task Force.
Great, thank you, Michael. As mentioned, my name is Alexandra Gallo, and I am the Health and Equity Program Analyst. So before diving into the results and findings from the statewide surveys and listening sessions, I want to share with you all how these findings will inform the development and structure of the HIAP Task Force, as well as help guide the policy priority areas for the HIAP Task Force to pursue, with the goal of advancing a healthier and racially equitable California. The findings the Othering and Belonging Institute will share with you today have helped develop a framework for really thinking through how we will relaunch the HIAP Task Force in 2022. Now that we have a better understanding of what is most important to stakeholders, we plan to disseminate the findings among state agencies and departments to gather information on existing initiatives related to the key priorities and recommendations identified by the Othering and Belonging Institute. We plan to engage directly with state agencies and departments to find alignment on policies and proposed initiatives. And finally, we plan to work with state agencies and departments to really hone in on what is feasible and develop time-bound priority policy areas that will help inform HIAP Task Force implementation throughout 2025, as you can see on the slide. Additionally, our key informant interviews, the research conducted by the Othering and Belonging Institute, and other organizational work this year have really reinforced that our HIAP work across state government needs to be rooted in racial equity as a key determinant of broader health and equity outcomes. So as we relaunch the HIAP Task Force in 2022, we will continue to embed racial equity in all policy priority areas and apply that lens to the recommendations identified today, all of which will be critical to our HIAP implementation efforts. So thank you, and with that, I'll hand it off to the Othering and Belonging Institute at UC Berkeley.
Thank you, Alex. Hello, everyone. My name is Nicole Montojo, and I'm a staff researcher at the Othering and Belonging Institute. I will start by going over the goals and intended outcomes of the stakeholder engagement process. So first, we did the online survey, as Michael mentioned, earlier this year in January and February. And the goals of this survey were to gain understanding of how impacted communities and stakeholders prioritize various elements of health and equity, to gather feedback from impacted stakeholders and communities on the institutional mechanisms that are shaping health outcomes, and to identify key constituencies and topics of focus for deeper inquiry in the subsequent listening sessions. And then in the listening sessions that we conducted in May and June, our goal was to document qualitative and nuanced input on health and equity needs and priorities at the community and local level, and to identify recommendations for HIAP priorities unique to and shared across regions in the state, including specific recommendations for action to eliminate institutional barriers to and advance supports for health equity. So I'd like to provide a quick overview of the participants in each of the elements of the process. So first, with the survey, we had 128 total responses received, and the largest share of these responses were from statewide organizations, including 27 responses from state government and 13 responses from statewide nonprofits. And then among local and regional organizations, as you can see in this chart, we had 27 from the Bay Area, 21 from Southern California, and 14 from Central California, as well as 4 from Northern California. And HIAP staff led outreach to stakeholder groups to participate in this survey. Contacts were identified through past HIAP task force membership lists, SGC contact networks, such as mailing lists and recipients of SGC resources, and targeted outreach. And as Michael previously mentioned, participants of the survey and listening sessions included state government employees and representatives of statewide, local, and community-based organizations. In the listening sessions, we had 30 total participants. And again, these were in May and June of this year. And we focused our outreach for the listening sessions on local and regional organizations. So most participants represented organizations with local, county, or regional scopes. And we only had 3 statewide organizations in the listening sessions, all of whom were nonprofits. And this chart just shows the participants by sector. And as you can see, we had the greatest number of participants from nonprofit organizations and also a significant number of folks representing local government. And we'll come back to the listening sessions in a bit, but I'll next go into an overview of the statewide survey. So, as a reminder, one of the primary goals of the survey was to gain an understanding of how impacted communities and stakeholders prioritize various elements of health and equity. And we use this information to identify topics for focus of deeper inquiry in the subsequent listening sessions. So survey participants were presented with a list of 17 elements from the Healthy Communities Framework, which HIAP had created previously, and were asked to indicate how much of a priority each area is to their organization in the context of improving health and equity for the communities that they serve. And so for each of these, they were asked to rank them as a high, medium, low priority, or not a priority. And these highlighted here were the ones that were most commonly selected as high priority elements of a healthy community among all respondents. So these includes receiving the most votes as high priority was housing, and then healthcare, employment, climate change, and safety. And this chart gives an overview of how participants responded and prioritized each element. And you can see here in the rightmost column, this shows what share of all of the votes for that element were ranked as high priority. So for example, among those who weighed in on housing, 67% indicated that housing was a high priority for their organization. And I'd like to also note the 3 elements with the greatest number of responses indicating that they're not a priority for their organizations are tobacco and smoke-free communities, arts and culture, and energy use. And for each of the other elements, fewer than 20 people indicated that they were not a priority. But it's also worth noting that while tobacco and smoke-free communities and energy use were among the most commonly identified as non-priorities, nearly as many people indicated that tobacco and smoke-free communities are a high priority, and more people indicated that energy use is actually a high priority, not a priority. One other difference we noticed in analyzing the results was that there was a distinction between how local and statewide and national organizations responded. Climate change appeared in the top 5 among all respondents, but when we examined the responses by region, it only appears in the top 5 of 1 out of the 4 regions, that being Southern California. And this is because the overall results of the survey were influenced by the statewide organizations, for which climate change received the highest number of high priority responses. So when we look at statewide organizations specifically, the top 5 elements are climate change, healthcare, housing, pollution, and emergency preparedness. And when we look at national organizations, the top 5 are then safety, housing, employment, child development, water, and pollution. So the next part of the survey, we asked about structural challenges and barriers to health. And the question on the survey was, what existing California state government policies or practices make it more difficult for your organization to promote health and equity? And the most common themes that came up here were around funding, rules and restrictions, lack of coordination, politics or power dynamics, policy, information gaps, and administrative practices. And just to give you an overview of some of the responses here, when folks talked about challenges with funding, a lot of these were around funding silos or funding criteria. Lack of coordination, people were speaking about fragmented systems, a lack of transparency, or a lack of communication between departments and agencies. With information gaps, a couple of the comments were about how there was a gap in how different people are trained to think along lines of health and equity in their day-to-day work. With policy barriers, there were several specific policies named, like Proposition 13, Proposition 209, CEQA, and then also this included the lack of implementation of policies that have already been passed and allow the most vulnerable to access resources without barriers. And another theme that came up several times was language access. And this will come back in later portions of our presentation. So we also asked about policies and practices that support health and equity. And here the question was, what existing California state government policies or practices most effectively support or enable your organization's work to promote health and equity? And here the themes are similar. People talked about policies that support their work and plans, programs and projects, funding, resources, transparency and community engagement, and public sector leadership. And here's a quick snapshot of some of the policies and practices that were mentioned in the responses. Several respondents lifted up environmental justice legislation, civil rights and anti-discrimination laws, statewide plans, like I mentioned, which include guidelines related to statewide plans, such as the OPR general plan guidelines, and also the Equity in Government Practices Action Plan. Funding, people talked about specific funding sources, and as also inclusion of equity as a metric for evaluating discretionary grant proposals. And lastly, public sector leadership was about public and high visibility of commitment to addressing climate change and how this gives authority and often state policy basis for engaging in climate action. So lastly, we asked the survey participants to reflect on what they would recommend for future HIAP task force work. And we asked specifically, what are one or two key actions that the HIAP task force could take to advance health and equity over the next 5 years? And we also added in that description, in that question, for instance, the task force may be able to help state government agencies in assessments, implementing policies, designing a policy, supporting guidelines, assisting with convenings and conferences, connecting state departments, connecting community organizations with departments, and other technical assistance activities. So from this question, we received a number of recommendations, and I grouped them into 4 broad areas. And so these are shown here: partnership and communications, policy, direct support, and research and data. And you can see under each of these more details about what these areas entail. So we received a total of 153 separate responses for future HIAP work. And the largest number of recommendations received were in relationship to housing, healthcare, and climate change. And as you can see in this chart here, this is a breakdown of the recommendations by priority area and focus based on the 4 broad areas that I shared in the previous slide. So we won't have time to go into all of the different recommendations for each priority area, but I'll go over the top 3, which are housing, healthcare, and climate change. So in regard to housing, respondents recommended that HIAP focus on connecting government agencies, funding sources, issues, and services, and that this could happen through state level collaboration, as well as regional and local collaboration that might involve fostering regional cross-sector collaboration and also working with local jurisdictions to develop anti-displacement or preservation and protection measures. And several others talked about the need to support building more affordable housing, and many named specific populations like older adults, families, homeless individuals, and supportive housing for people with mental health and substance abuse needs. And lastly, others recommended specific policy changes related to inclusionary zoning, ban on single family zoning, and also incentives for affordable housing. On healthcare, a lot of the responses were related to support on data and metrics, and also culturally competent care, expanding healthcare access for all, and community engagement. Under data and metrics, a lot of what folks recommended was around assistance in creating standardized methods of data collection and ensuring that data on race, ethnicity, sexual orientation, and gender identity is collected across all systems. And there was also several responses related to the need to further disaggregate data and to gather data and facilitate data sharing across agencies. Under culturally competent care, respondents talked about the need to collaborate with county and city level agencies to provide bilingual information about healthcare services and resources, to enforce the use of skilled interpreters and support healthcare workforce development opportunities for disadvantaged communities of color or disadvantaged communities and communities of color, and to create an accountability framework for equitable and culturally congruent healthcare. And then under healthcare access for all, people mentioned specifically the need for this to include both physical and mental health care, and to look at expanding healthcare in different forms, including expanding access to Medi-Cal and Covered California, but also telemedicine. And under climate change, many of these recommendations were about guidance and technical assistance. Regional and local agencies recommended helping them plan for and anticipate disproportionate climate change effects on disadvantaged communities, and to develop and provide guidelines, toolkits, data standards, prioritization methodologies, and technical advisories related to climate change. Another common area was around connecting and bridging issues. This involved elevating climate change as a public health emergency and an equity issue, but also connecting climate change with tribal climate resilience priorities, forest management, and issues related to extreme heat, wildfire smoke, and other negative impacts. And then also connecting climate change to land use, housing, and mobility. And again, here, community engagement was another theme. Respondents recommended creating forums for discussing development, implementation, and monitoring of frames and tools for resource allocation, and providing funding opportunities for nonprofits and community organizations to engage their communities on equitable feedback for climate resilience projects. And so I've mentioned several times that community engagement and capacity building had come up in many recommendations. And so I wanted to draw attention to these specifically. Many recommendations talked about the need for funding and capacity building for community-based organizations. And this is something that also came up in the listening sessions, which we will talk about next. Respondents talked about the need to support capacity building for CBOs in applying for state and local funding, as well as in applying for contracts and procurement. And when folks talked about capacity building, they were talking about the need to strengthen capacity for community-based organizations who are at the forefront of addressing health and equity issues, but receive inadequate funding and are dealing with a lot of bureaucratic processes. And so there was a call for greater flexibility to ensure that resident engagement and leadership is possible. And lastly, folks recommended that ensuring that funding opportunities and resources are low barrier and functionally accessible. Apologize for the barking. And now I will turn it over to Eli to talk about the regional listening session.
Thanks, Nicole. I'm Eli Moore. I'm a program director with the Othering and Belonging Institute, and I'm going to present some of the highlights from the listening sessions. So the goals for the listening sessions were to kind of get under the surface and get more nuanced qualitative input from stakeholders, community leaders around the needs and priorities for advancing health and equity at the community and local level, and to identify some of the recommendations that didn't come through in the survey that folks wanted to share that could inform the HIAP task force work plan and priorities. So emails were sent out to 240 health and equity stakeholders across the state, and additional context and outreach support was provided by Strategic Growth Council, Public Health Institute, and the California Pan-Ethnic Health Network. And then we did individualized follow-up emails with a focus on community-based organizations and public agencies, especially based in populations, communities who are underrepresented in the statewide survey. So we grouped the questions for these listening sessions into 4 broad areas that you've already heard a little bit about through the survey. Firstly, partnerships and communications. What are the ways that the state can improve their partnership and communication strategies for health and racial equity? What strategies have been most effective in the past, and other related questions. And then funding and direct support. So what forms of direct support are most important? What are ways to distribute direct support to improve racial and health equity in your community? The research and data, asking what state level data tools do people currently use? What kinds of data collection or research would be most powerful for advancing race and health equity? And lastly, policy. What are the most important state policy strategies that currently exist, and what could be advanced as far as new or changed policy? So we wanted to begin with just highlighting some of the strengths to build on that people mentioned in the listening sessions. Across all 4 sessions, there was a sense that during the COVID-19 pandemic, some agencies at the state were able to pivot and rethink how the state operated in ways that were more responsive to community needs. Many participants across the regions reflected a desire that that type of flexibility and accessibility would continue. So for instance, there was an effort in the Central Valley called Housing for the Harvest, where the Department of Food and Ag and other agencies were able to work with communities to pivot their program, iterate their program within just a few months, and work with CBOs and respond to the needs of farm workers who had been exposed to COVID-19. Another strength to build on was that folks felt that across the regions, they had found some of the state data helpful for thinking about health equity and disparities. Although there were issues in each region around data gaps and what could be done better to gather fuller data pictures and disaggregate the data. In the Central Valley, participants mentioned good partnership experiences with specific agencies in the context of COVID-19, specifically the COVID-19 Equity Project and contact tracing efforts. There was a general sense that state agencies are moving towards better alignment and are more competent thinking about the social determinants of health. And some of the specific things mentioned were the ability of state agencies to work with new CBOs based in communities that were disproportionately affected by the pandemic, and to develop materials in languages that hadn't been included in the materials that were already being used. In Southern California, respondents called out the relationship between the state and county as a success, and that there was a strong feedback loop between the local county and state partners, and a sense that the state had improved its alignment and coordination. So moving on to some of the recommendations. And we just want to acknowledge that the HIAP task force has this unique role in California where it doesn't have formal power to require state agencies to take specific actions. And so these recommendations were developed based on the feedback from stakeholders, while keeping in mind that the scope of the task force role includes things like convening, training, encouraging, advising state agencies and departments, and engaging community stakeholders. So the first set of recommendations is around communications, partnership, and policy. And the priorities here from the respondents were to build authentic relationships and feedback loops for ongoing two-way communication with local partners, and to really just establish durable, deep local connections over time to support more intentional allocation of funding to organizations who are closest to and reflective of and rooted in impacted communities. So for instance, one participant said, there should be a focus on building relationships with community power building and organizing groups to guide their decision-making, planning, priorities, and implementation. State health and all policies has been very internal to government focus and needs to really engage with most impacted communities so they can provide accountability, inside-outside strategy, advocacy for policies when agencies are politically constrained, and to make the racial and health equity component of state health and all policies work more true and grounded. So some of the specific recommended actions in the near and medium term were to meet with regional coalitions to understand their policy agendas, priorities, proposals, to identify opportunities to link Strategic Growth Council's task force work to work happening at the local and regional level. And in the longer term, to build durable structures to get substantive input and these feedback loops on funding and program design, specifically with community-based organizations representing groups with the highest health impacts. Turning now to the recommendations related to funding strategies. The priorities that were named here are to ensure equitable access to state funding by addressing funding rules and barriers faced by grassroots organizations, to support capacity building, to fund critical health equity work that communities are already doing despite the lack of state support. So one participant said that under existing grant structures, the rich get richer and the poor get poorer. Entities that have the ability to write and administer grants get awarded, while lower capacity organizations without grant writers get passed by. And so some of the specific recommended actions in the near medium term are to develop a strategy to create a streamlined, customer-oriented funding application and reporting process for agency grants across different agencies. Expand technical assistance for most impacted or lowest capacity jurisdictions and organizations. And in the medium term, develop best practices guide for agency grant making to align with health and all policies. including suggested criteria and metrics for evaluating grantee proposals. And in the long term, implement a multi-agency equitable access and customer-oriented funding and reporting strategy to remove those barriers. Turning now to data and research and analysis, the priorities that the respondents named in these listening sessions related to this area were to know who is most impacted by health inequities, and to do so, to disaggregate the data to ensure that impacted communities are not getting lost in aggregate numbers, and to leverage partnerships to gather more nuanced forms of data. For example, qualitative, community-level data, community-based research projects, community indicators, etc. One participant from Central Valley said, "So many health disparities get hidden in the data when it's not disaggregated, especially for refugee communities." So they are naming the fact that if your community is lost in these broad social categories in the data, then you actually are at a disadvantage to even name the need and quantify the need, and that may be a requirement for getting funding. And so there's this barrier created in the way that data is collected and analyzed that then affects funding for those communities that are not made visible. Some of the recommended actions in the near term were to identify a data team to develop new methods of data collection for small populations, small geographies, and tribal communities, including expanding funding for community-based participatory research to develop new data collection methods for small populations and geographic communities. And then in the medium term, to test the integration of new data collection methods for small populations and geographic communities into a subset of agency funding and reporting requirements. And in the long term, integrate new data packets and methodologies across agency funding and reporting requirements. So to review, this was a high-level presentation of the recommendations that came out of the listening sessions across these 4 areas of partnerships and communications, policy, funding and other direct support, and research and data that are all oriented towards supporting local power, capacity, and partnerships that would advance equity and health across the state. That's the end of our presentation on the findings from the listening sessions and survey. And thank you so much for joining us.
Thank you so much, Eli and Nicole. We would like to express our gratitude to all participants in the stakeholder engagement process for their contributions in informing this work. We're also very grateful to the Othering and Belonging Institute for facilitating this work and identifying findings around priority areas and recommendations for the California Health and All Policies Task Force and state government agencies. There is much more that we must continue to do to advance health and racial equity, but the results from this work have highlighted that some of the key health priorities for communities across California include housing, healthcare, and climate change mitigation, among others. The Othering and Belonging Institute has also reinforced the importance of building on lessons learned from the COVID-19 pandemic to better respond to community needs. This includes via partnerships, technical assistance, capacity building, and data collection to develop a deeper understanding of the state of health and racial equity, and to enable stakeholders to integrate these issues into their work, while also striving to remove barriers to promoting health and equity. As we plan for the reconvening of the Health and All Policies Task Force, these findings will be instrumental in guiding our work and recommendations for state agencies. Thank you very much for joining us today. This concludes our webinar. If you have any questions related to this work or the Health and All Policies Task Force, you may reach us at hiap@sgc.ca.gov. Thank you.